So hi, welcome. We're joined today by a range of friends and guests. I'm Sarah Aston. I work in the Torbay Council Public Health team as a specialist. And we're joined by our Zoom. Give us a little hello or wave, please, Eileen, if that's all right. Hi, Eileen. Thank you. And we're also joined by our colleague Helen Perkins, who's going to be giving us a little bit of technical advice as and when we need it. Eileen and Helen will be monitoring the chat, so forgive me, I won't be able to see any of the chat comments. We're also very lucky to be joined today by our colleague Nellie, who is us from the Devon NHS Clinical Commissioning Group. So give us a wave, please, Nellie. We'll be hearing from her in a moment. Excellent, thank you so much. So without any further ado, can you all see my screen okay? Just give me a nod if you're seeing anyone waving their arms wildly. I'm going, we're okay? Okay. So I think is available to watch again on the Torbay Council website, and if you'd like to do that, we had a really good session with Rachel Williams talking about back to school and education settings. So if you'd like to know more about that, please go to our apologise again for the technical settings. A really genuine and heartfelt warm welcome to everybody. Thank you for coming. Okay, so let's crack on, shall we? Now, outline of the session. What are we doing today? Well, we're going to have our welcome and intro. I'm going to run through a couple of bits of etiquette. Nellie's going to have a chat with us about vaccine ambassadors and some things that are happening with the Clinical Commissioning Group, or the CCG as we call it. So forgive us if we use a bit of jargon there. We're going to have a couple of questions from you guys, and then unfortunately Nellie's got to push off at once, so we've got to make good use of her while she's joining us. I'm then going to do the usual update on COVID-19 and a bit data, which I know a lot of you enjoy, questions, and we will be done by 1:30, if not before. Hopefully that's what you're all expecting to see today. In terms of webinar etiquette, can you stay on mute unless you're speaking? It helps us manage and not sort of hear your dog barking or your phone ringing or kids in the background. If you want to speak, there's a little hand gesture that you can use, so by all means, please do so. If your signal is poor, we might disable your video, but you could disable your video as well. It might help boost the bandwidth. If you do have questions, pop them in the chat. Be nice. Nice. Everyone's here to be lovely, so I can't tell you when you're going to get your vaccine or when your family are. I also can't comment on national political issues, and we won't do that either. We would encourage you to write to your councillors or MP if you have political questions. But you can always email us with your thoughts, questions, and we do all that we can to get those answered by the right people. So feel free to email us at champions@torbay.gov.uk. So if you have a question, please write it in the chat. There's a little chat box which is circled there in red. And if you want to speak, you click on the participant box and there's a little blue hand that comes up. Alternatively, just wave your arms wildly and hopefully Eileen will see you. If you can get Eileen or Helen Perkins' attention, they'll interrupt me and field questions. So champions, some of you might be new. If you are, a very warm welcome to you. It's a lovely temple idea. We work, this is the public health team, part of Torbay Council. Work incredibly closely with partners and GPs across the local systems. and we try to give you some really good, credible information about COVID-19. You tell us what you want to know, and we try to give you the answers and have a chat about it. What your role is, though, because it's not just about you turning up and asking us lots of very insightful and sometimes terribly complex questions, which we appreciate. It's about you then telling your people, whoever your people are. That might be your workmates, it might be your husband or wife, it could be your kids, it could be your cousins, it could be any, it could be just having a moment on Facebook, whatever. The idea you are the best right information. Hope is that go on to spread the right information. We're here to learn a little bit about COVID-19, and I'm 2 minutes over, sorry, Nellie, but it's over to you if that's okay. This is our colleague Nellie, who works for Devon Clinical Commissioning Group. She's going to tell you all about what they've been up to.
First of all, Sarah, can you hear me? It's Nigel or not?
Hello, Nigel.
Just to tell you, I don't know if anyone else is having the same problem, but you're breaking up so much shocking, and it's our job to actually get the gist of what's going on.
Okay.
The internet connection's bad up there because of being so far away.
Sorry, someone else is talking. Tracy, can you put yourself on mute, please? Nigel, I'm going to do what I can to sort my connection out. Nellie's going to take it over for now. Okay, I'll do what I can. Yep. Thank you for letting me know.
Hi everyone, my name's Nellie. Thank you, Sarah. My name's Nellie, and I work for, like Sarah said, for the Devon Clinical Commissioning Group. I am the Senior Strategic Engagement Manager for the CCG, which basically means I work in the communications team, and my job is to oversee all of the engagement that we do. For the past sort of 6 months or so, it's probably safe to say, I've been working tirelessly, I think it's fair to say, on the vaccination programme, along with an awful lot of colleagues. And it has, so what I'm going to do today is just give you a really high level update of some of the things that we've been doing and where we've got to today. And then what I really wanted to focus on and tell you about was some outreach work we're doing to support people who haven't been able to access the vaccine for whatever reason. So I hope that all sounds okay. Thank you very much for having me, and yeah, happy to take questions as well at the end. So the Devon vaccination programme has been going really well. We've vaccinated over 500,000 people across Devon, Plymouth and Torbay, which is, you know, it's really astounding considering the time frames we've been looking at. 520,000 people to be specific. And there's been various ways that people have been able to do that. So we've had primary care, so GP practices. We've been at large vaccination centres at West Point and in Home Park in Plymouth. Those are our 2 really large sites. And then we've kind of commandeered, or our GP practices have commandeered various other sites where we've turned sort of community centres like leisure centres or tennis clubs or even a pub in some instances into vaccination sites as well. So we've been doing an awful lot of different things to try and make sure the vaccination is able to get to as many people as possible. And then we've also had pharmacy sites that have come on board recently too. So that's kind of where we're up to now, and that programme is continuing at the moment. So as you'll probably all know from all of the national media and things like that, we're getting through cohorts. The Joint Council for Vaccination and Immunisations, the JCVI, they're the organisation who identify the cohorts of people who should get their vaccine first and prioritise those people. And so those groups are broken down into different cohorts, as you probably know. And we're focusing on 1 to 9 at the moment. So that's basically everybody who's over 50 And there's this cohort 6, which is for people who have got any underlying health conditions which make them more vulnerable to getting seriously ill with COVID. Now, I have got a terrible feedback. Can anybody else hear me twice, or is it just you can hear the feedback as well?
And it's a little bit difficult, isn't it? I'm going to keep putting myself on mute though. Can I encourage everybody who's not on mute to go on mute? So Nigel, Tracy, me, can you go on mute, please? Thank you. Nelly, keep going.
Okay, I'll keep going. Great. So like I say, the vaccination program has been going really well. Lots and lots and lots and lots of people getting their COVID vaccination, which is fantastic. But one area of work that we're really trying to focus on at the moment is around inequalities and people who, for whatever reason, haven't yet been able to take up the vaccination in even though they've had their invitation and they're in the right cohort. So there is a whole work stream that is focusing on inequalities and encouraging uptake of the vaccine across some of our most vulnerable communities. The way that we're doing this is so it's really being driven by insight. So we're reaching out and doing various different engagement activities to really understand what the concerns might be from different communities. Is it around, is it because people are very rurally isolated, for example, and they just find it very difficult to get to a vaccination site? Is it because, people have concerns about the vaccine themselves, so that we know that across some, different cultures, people have concerns about whether the vaccine is okay to take from a religious perspective, around what the concerns about the ingredients. So we're doing an awful lot of insight to really understand what the issues are and understand what the issues are for different people in different ways. And then looking at, right, okay, so how can we therefore, with this information, how can we therefore support people to find a different way that we can provide access to the vaccination. So one of the ways that we're doing this is looking at what we're calling pop-up sites, and that is where on a very temporary basis we would go out into a community. It could be in a faith centre, so a church or a mosque or a synagogue or whatever, or a community centre or a school hall, for example, anywhere where we know that if we were to bring the vaccine into that community, then those people would be more likely to have it. So that's a piece of work that we're doing at the moment. We're also developing, and this is how Sarah and I got in touch actually, we're also developing a network of vaccination ambassadors. So those are much like yourselves, I suppose, but slightly different, but a similar concept. So these are people who work across health and social care sectors who are part of some of the communities where we know there's been some hesitancy around taking the vaccine. So that includes, we've had concerns around fertility for some of our childbearing age. And so we've got some ambassadors who are of childbearing age, who are kind of those trusted voices from the NHS and social care who can represent those communities and share the information about the vaccine that's up to date, and hearing it from a trusted voice we know is really powerful. So it's a fantastic, as you all know, actually being a champion or an ambassador, it's really heartwarming that so many people have come forward and said, yes, I really want to, I'm a cardiologist, we've got a fantastic gentleman who is a cardiologist at one of the hospitals, really busy, but really wants to work with us so that he can support his community to have the vaccination. So that's a really it's a really exciting program that we're working on. And then the other thing, which might be useful for all of you, is that as part of our kind of outreach approach to all this, we're offering question and answer sessions. So if there was a group of people who had concerns about the vaccine and just wanted to ask some questions before they felt confident about going to have it, then we're providing a kind of question and answer session where where there would be an opportunity to speak to a clinician about, you know, what the risks might be, what concerns are, do a bit of myth busting if that would be, if that's, you know, if people need that. So that's, you know, one of the, that's yeah, we hope that will be taken up quite a lot across the community, because we know, you know, it's okay for people to feel concerned that COVID is a new illness. The vaccinations are, you know, we've not ever been in this situation before, having to do a mass vaccination program like this. So it's okay for people to have questions, and we just want to make sure that people have the opportunity to kind of talk through their concerns so that they feel happy about having the vaccination. So that's a real kind of whistle stop of what we're doing. I'm conscious, like I say, I'm afraid I have to go at 1 o'clock, but I'm really happy to take some questions if that would be helpful. Sarah, I don't know if there was anything else you wanted me to add to that.
I think that's really helpful, Nellie. It's a huge amount of work you're doing. I can see a few hands going up though. Councillor Hazel Foster, would you like to start off with a question, please?
Right, thank you very much. Really good presentation. I'm really glad to hear about the pop-ups that are going to be going ahead. I'm aware that there's some people who can't have the vaccine because of the treatment that they're on. If they're on a certain type of chemo, that they're unable to have the vaccine. So I think it's been talked about that new vaccines as they come on might be suitable. So I was just wondering if you've got any information about any of the new vaccines. I know they're also doing trials, vaccines for children as well. So just wondering if you've got any news about the future.
So I don't at the moment. So I think the thing to say about the vaccine programme is that it is a nationally driven programme of work. So it's not, and it's something that we are pushing out locally, but it's overall a national programme. And any kind of developments of new vaccines will be, you know, all happen through the MHRA. You know, that's where the approval will happen, and then we just get told, here's your vaccine, and can you give it to all of your communities, please? So I'm afraid I don't have any information on new ones, but I would say that if anyone's got concerns about treatment that they're on, to kind of contact their GP or you know, contact a health professional when they get their invitation for the vaccination.
Excellent. Thank you very much, Nellie. Thank you, Councillor Foster. Tracy, I can see your hand up. What's your question, please?
Hi, I'm just wondering the best way for people to access the pop-up vaccination centres, to get that information, how it'll be publicised?
So it will really depend on where the centre is. So normally the pop-ups work best when we work with the community organisation who have identified a need in their local area, and we would be working with those community groups around the booking and the publicising of the pop-up. What we do know is that at the moment we're very much in cohorts 1 to 9, so the eligibility of people, you know, we have to make sure that we're vaccinating the right people, or sorry, not the right people, the eligible people, the appropriate people, and so booking would be done in partnership with, you know, the centre that we were working with in terms of identifying the people to attend.
Okay, lovely, thank you.
Tracy. You. Have you got a community in mind, thing on your mind?
Oh no, it's just that I'm chairperson for Tor School, and I know with sort of the different ethnicities and backgrounds that there are a lot of people that are worried about it. And how's the best way to publicise that? I'm within the church community, All Saints in Banfield Road and Tor School, and I just wondered if there was something you could put out there. So if concerns with this, contact these.
Yeah. So a couple of things. It sounds like a Q&A might be really helpful for that community, a kind of opportunity just to come and sit down, ask some questions. We could get a vaccination ambassador to join us. But the other thing is that if there is a need, if having a pop-up at the school, for example, where people come, you know, basically what happens is some vaccinators come with a cold
Yes.
box full of the vaccines, and they just give the vaccinations in a much more familiar environment. So if there was a need, so by all means, Tracy, if you want to drop me any, I mean, Sarah can probably share my contact details. So if you've got a community in mind, absolutely, please just let me know.
Okay, lovely. I'll speak to the head teacher.
Yeah, great.
And the vicar of All Saints.
Perfect.
Okay.
Thank you.
Oh, that's lovely.
Tracy,
Thank you.
Tracy, I think we've been in touch before as well, haven't we? So let's get in contact afterwards, and we'll start a little email between you and Nelly and I.
Thank you,
Yes,
Sarah.
I remember. Yes. All right. We'll follow that up, Tracy. Thank you.
Okay, thank you.
Right. Back on mute for you, and then me after we take a question from David next, if that's all right, please.
With the West Point Centre, I know it's Exeter based, but a lot of people from Torquay here go to the West Point, including myself and some of my dear friends on screen here today. With the scaremongering from Devon Live, with those people that have their second appointments booked, are they still being honoured, or have they got to wait for notification?
So I think I will need to come back to you on that, because I need to find out what's happening with the second doses. But I can go away and get the right answer and feed it back to you, Sarah. It's very difficult. I'm not operationally involved in the actual details of the programme, so I don't have the answer to that question to hand, I'm afraid. But I can go and find out what the message is for those people.
That's great. Thanks very much.
Thank you, David. Just to let everybody know, if there's a question here that we answer, what we'll do is we'll put the questions into a new slide and the answers into those slides. And then when you come to go to our website, you can see what they were. We do answer all the questions that we get. So if you look at any of our previous events, the questions that were asked are all answered in the slideshow as well. So yeah, we don't know everything. We can't know everything, but we'll always try and find out if you know who does. Okay, back on mute for you, please, David. Tracy, is your hand still up? No, I think so. Eileen. Is there anything in the chat, please?
Okay, we have a question from Ahmed. So that means everyone in the UK must take, and will the vaccine, or is it just British citizens only? The reason he asked that is because 14 members of his family had the vaccine except him.
So absolutely, the vaccination is absolutely not only for British citizens, and it is for everybody.
And the next question is from Eileen. Are you concerned we may get a shortage of the vaccine?
Again, not a question I'm able to answer, really. That's a kind of national issue around vaccine supply. There's an awful lot happening in the media around supply and things like that, and it's not something I've got an answer to at the moment around supply.
And the only other one is from Paul. He said, would Paynton Library and Info Centre make a good venue, given the connections area is very quiet? The cafe could make a good post-vaccine waiting area.
Potentially, no. But we're really kind of there's an awful lot of things that that kind of need to be in place to ultimately, when we develop a pop-up site, it has to meet very strict infection protection control standards, because it becomes a clinical environment. But there's no reason to say we're looking at developing a pop-up site in a mosque, in community centres, in the pub, like I say. So a library, I can't see why not. If there was a need for in that community, then it could be explored.
Brilliant. I love your suggestions, guys. You're so, yeah, makes a lot of sense, I think, to consider painting library as a pop-up. It's such a good central point. Everybody knows it. You can get there by train, bus, tram, trap, everything. All right, we will definitely bear that in mind. It could be a really good pop-up site for picking up some of those groups. I've got a bit more about the local coverage and pop-up sites in our data update a bit later on, but good shout.
Sarah, it's Nigel. Just a comment from Dave. I think was it David regarding the Exeter site. In the media, it did suggest everyone who went there who had their first vaccine before the 1st of April will still get their second vaccine. However, the dates may be moved. All
right, Nigel, thank you. I know that you're a sharp eye, a sharp listener on these things. So
you got it right first time.
Yeah, sorry, mate.
So I have just had an update from so I put the beauty of Teams and digital meetings, that I did just pop a question in my Teams chat about the second doses, and the answer is people should continue to go unless they've been contacted.
Okay.
Very clear. Unless anyone's been contacted, then go ahead to the appointment for second doses.
Okay, thank you, Nelly. We've got a few minutes left. Oh, David, I think you've got your hand up. David Hobson.
Hi.
Hello.
Quick question for Nelly. I know she's not operations, and I haven't seen anything on Devon Live. I'm a volunteer vaccinator with St John's, and I was due to work on Sunday, the 4th of April. And my shift, along with many others that week, has been cancelled. And it appears to be linked to supply issues. So just to flag to you that maybe there's an issue there that the clinical commissioning group needs to manage around what's going to come out in the media.
Yeah, so I think that yeah, like you say, David, I can't comment on shifts that have been cancelled and various things like that, I'm afraid. But yeah, good to know. Good, it's a good heads up. I think yeah, you know, I think that there is. The government has announced that there is, you know, there's a reduction in supply during April, and that, you know, that's been very clear in the national media, and so in Devon we're very much working, you know, operationally working around how we manage that, and so, you know, having to do fewer sessions on a temporary basis because the supply is reduced is something that is going to need to happen, but I think that it's very much a kind of, it's a short-term thing. So I hope that's helpful.
Yeah, agreed. It is. I think so anyway, Nelly.
Thanks, Sarah.
Right. Nelly's out of time. Has anyone got an absolute burning question? If you don't ask Nelly it now, you're going to explode.
I'm happy to take questions, you know, and if it's been helpful, you know, if we, you know, like I say, you know, the clinician, we could get a clinician to attend, or if there's, you know, and, you know, likewise, kind of hearing any insights from your communities that you're part of and that you're engaged with, you know, Tracy, it's really great to hear, you know, the feedback that there's, you know, communities where you are who are a bit hesitant and concerned. You know, we are learning all the time about how best to roll this program out to as many people as possible. So the more feedback and the more, you know, insight we can gain from all of you, the better. So thank you for all the work that you're doing. It's really great. And Sarah and the team as well, I know, doing a great job in it also. Thank you.
No problem. I've been trying to tell the group about how the insights that they gave you in November and December informed your report on the work that you're doing. So actually the champions are having a direct effect on what the CCG
Absolutely.
do.
Have you all seen that report? Have you seen that report?
I put the report and the video in the last bulletin. Well, I put the videos in the last bulletin, but we can circulate the report if you want to.
Yeah,
as well.
Happily, because yeah, it's really directly had and directly impacting, you know, the way the program's rolling out. We are doing another piece at the moment, actually, because it's very, you know, the concerns and the issues and the anxieties have shifted enormously from, you know, why people were a bit hesitant in December compared to why people are a bit hesitant now. You know, it's a completely different group of people, and we're in a completely different climate with, you know, vaccines having been around, you know, millions of people have been vaccinated now, so the concerns are very different. So I would really encourage you, you know, we're really trying to reach out to our, you know, younger really, to try and get us to understand how they feel about it. So I will make sure I share that with Sarah when we start moving on it, and then yeah, all feedback would be really, really welcomed. So thank you.
Okay.
And I'm sorry to go early.
Well, Nelly, please stay a friend of the Torbay champions. Please stay in
I
touch with
will.
us. We'd love to have you back, I'm sure. If you can show your appreciation with a thumbs up or something like that through, we'd be delighted. But thank you, Nelly. Thank you for joining us.
Thank you, everybody.
Have a wonderful day, and we'll share your details.
Thanks everyone.
Nelly. Have a good day. Bye-bye. Fabulous. Well, what a lovely guest. And I think you did the best you could with what you had, but your questions were out, and the link to the clinicians and the Q&A and being able to do pop-ups with you, all good. So I'm going to move on, and I think one of the things so without any further ado, I'm going to go for that. Actually, before I go any further, as you know, I can't see the chat. I can occasionally look at it, but Eileen and Helen, is there anything that we need to pick up on? Anything outstanding from the last section, please?
No, just Paul Sutton just said he agrees with evidence. He's had the first vaccine, first dose, and would welcome a passport and document to help him evidence having the vaccine. Ideally, paper to stop abuse via digital platforms, as he doesn't have a mobile phone.
Lovely point. Lovely point. I think one of the things I sometimes wish is that we could debate some of these issues with you and hear your views. We've got views, but yeah, I think some of these things are going to become increasingly real, particularly if you want to go on holiday. So fair comment. Thank you very much. Anything else, Eileen?
No, that's it really. Okay,
I'll move on to the data then. So COVID cases in Torbay, from the 1st to the 7th of January, we had 314 cases. From the 1st to the 7th of February, we had 172 cases. For the week of the 14th to 20th of March, we had 37 cases in Torbay. The rates are currently 12% of the rates at the start of January. And this latest data is for the 7-day period ending the 20th of March. So it's the latest data we have available. I've had a couple of queries from some of you lovely champs wanting to know why there's a bit of a difference between some of the numbers that you see. And there's a lot of reasons for that. The first one is, I don't think anybody's lying or trying to mislead you. I think it's about how we count things. Also, there's often a bit of a lag in terms of a couple of days. So I could tell you how many people there were yesterday, but do you know what? That might change, as in they might not be confirmed, they might need another test, they might not be from Torbay. And so the data always takes about 3 days to really settle down and be confirmed. And it changes within those 3 days as well. So we wait a few days before we tell you what the numbers are, because we're trying not to cause confusion. So that might account for why there's sometimes a bit of a discrepancy. The latest data, so as I said, the latest data is for the 7-day period ending on the 20th of March. The number of cases is 37, which equates to 27.2 per 100,000 people in Torbay. The rates during March within Torbay are the lowest since late September 2020. And with the lockdown starting to ease, it's unlikely that our rates will get much lower. I think that's an important point to take away. I don't know about you, but I've noticed that some people on my street seem to think that lockdown's over or are starting to behave as if it might be. Well, this is the lowest it's going to get in our communities, with that in mind, because from here on in, people are going to be continuing to mix, if not more. So if we want to see Torbay at 0, we would need to take far more evasive action and measures. So these might be our lowest numbers that we see. And as I said, they're the lowest since late September 2020. Okay. So moving on, the rates in England are currently at 8% of their early January peak. The rates in the southwest are currently at 7% of their early January peak. So the rates, the other thing to say is that the rates in England and the southwest and Torbay have all started to flatten out in the last 2 weeks. So we're at a plateau. So that number of 37 is ish, give or take a little bit, remaining fairly consistent. We think this is as low as we're likely to get. I'd like to be pleasantly surprised and see it drop further. I genuinely would. I'm not sure it's going. Okay, so we're comparing very well with the rest of our colleagues in the southwest and very well in England. In terms of hospitalisations in Torbay, as of the 16th of March, there were 8 confirmed COVID-19 patients in Torbay and South Devon NHS Foundation Trust. This includes non-Torbay residents, so our colleagues, our friends from Teambridge or the South Hams, for example. Numbers at Torbay and South Devon Trust are at their lowest levels since early October. And this is the latest publicly held data available that we can let you know about. As you'll remember, deaths lag behind cases, and there's usually a few weeks before we see the impact, if you like, of high cases or any cases. We think this might change as the vaccination rolls out. So we're hoping to start seeing a breaking of the link between the number of cases and the numbers of deaths. But everybody's keeping a very, very, very close eye on that at the moment across the country, in fact, worldwide. In terms of COVID deaths, this data relates to those who have a COVID-19 on their death certificate by the date registered. And these figures are from the Office for National Statistics. There have been 53 COVID-related deaths for Torbay residents in the last 8 weeks. The majority of these deaths tragically relate to care home residents. There have been more COVID-related deaths in the period since October, the number being 106, than we saw in the first wave from March until June 2020, where we saw 58 deaths. Once again, the rises in deaths lag significantly behind rises in cases. This is terrible, tragic news, and what we know is that people are still dying in our community from COVID-19 and related complications. COVID vaccinations. Now, this is the latest publicly available data. I've managed to sneak something extra special for you champions a little bit later on, but for now, let me tell you the headline news. So the vaccine update within Torbay as of the 14th of March. Again, I appreciate there's a little more of a lag here than I would like to have given you, but I've got an update. So the latest publicly available data suggests that the number of Torbay residents vaccinated with at least 1 dose is 95% or more for those aged 65 and over. The first dose vaccinations for England between the 16th to the 22nd of March is 3,014,909. Sorry, 3,014. Why can't I read that number? 3,014,909. 524. I'm sorry, I'm having a number Lexia moment. Do forgive me. 524,457 people have had their second dose in that 7-day period. So in total, over 24 million people in England have had their first vaccination dose, and this represents approximately 55% of the adult population in England. I think it's fair to say this is an incredible achievement as a nation to have vaccinated over half the adult population. I'm a student of public health, and looking at the history of vaccinations, I'm telling you, this is absolutely extraordinary. We are living in historical times. And I think we should be really proud, actually, that we've managed to cover so many of our vulnerable adults and populations. Okay. Now, this is a little bit wordy, so do bear with me. But I had a chat with my pal Mark this week, who works in the Torbay public health team. And you might or you might not know, but the council public health team are involved in all aspects of COVID-19. And one of those is about coordinating primary care networks and their delivery of vaccinations. We particularly talk about the whole population of Torbay and our most vulnerable populations. A primary care network is where GPs come together. So your GP surgery might now be part of a network of 2 or 3 others. And this is what we mean by a primary care network, or PCN. So the headlines from the Torbay primary care networks are that vaccination progress is going well, although the central government amended timetable due to the AstraZeneca supply will have an effect on this from the 1st of April. There is a small remaining number of people not invited across cohorts 1 to 9, and this is largely due to the issues of contact, such as patients not updating telephone details. Outstanding patients have been targeted throughout March. The primary care networks have extended their contract to vaccinate 18 to 49-year-olds, but this can only commence from the 1st of May. So we're going to see all of those groups being invited to vaccinate after the 1st of May. The rest of March and April, the primary care networks will be tidying up everybody outstanding from cohorts 1 to 9 and all second doses as within the existing timetable. The second doses of housebound patients and care home residents is happening as we speak through a roving model. So people are going into those settings where they need to and delivering those vaccinations. The first dedicated clinic for local homeless population and rough sleepers took place just this Saturday, and I understand it went quite well. And Brixham Rugby Club will be open as a pharmacy-run vaccination centre from Monday the 22nd of March. All bookings go through the national system and are separate to the primary care network programme at the Riviera Centre. So just to remind you, COVID vaccine prioritisation group 1, the prioritised group, are residents in care homes for older adults and their carers. Number 2 is over 80s and frontline health and care staff. Number 3, over 75s. Number 4, over 70s and clinically extremely vulnerable individuals. Number 5, over 65s. Number 6, under 65s with underlying health conditions. Number 7 is over 60s. Number 8 is over 55s. And number 9 is over 50s. So our hope in Torbay is that groups 1 to 9 will all be completely, will have all received at least their first dose of the vaccine by the end of April. If that's not a key message for you to tell your pals, I don't know what is. Please spread the word, okay? We're doing okay with this. We're going to get there. Any questions, please?
Sarah, it's Nigel. The only thing I've come across, it doesn't affect me, because to me, even though one can't see the letter, it was very clear, but a lot of people are getting concerned that the central government letter that comes through inviting them to places like Exeter or Exmouth for their vaccine, they have to do that, otherwise they will not get their vaccine. And trying to explain to them that's not right. It's their choice if they wish to go there, otherwise they need to wait for the NHS hospital or their GP for the vaccine.
Okay, sorry, is there a question there, or sorry Nigel, I might have misunderstood.
Basically, how can one get across to people that the central government letter doesn't mean they've got to go and they can actually wait locally?
Well, how do we communicate these things? I have to say it's extraordinarily complicated, and there's a lot of messages and a lot of information we're trying to give. I don't know is the bottom line. I don't know how we let people know how much choice they have. There's a lot of websites that you can go to and a lot of kind of places that you can find this information, but also I really acknowledge there is so much out there, it's hard to know. This is why we do things like champions, so that people like you can tell people like that, and in a way, in a time and a place that suits them, and hopefully you'll be a credible source. Helen, as our technical leader, is there anything that you'd like to add to that, please?
Yeah, because I think I know what Nigel's talking about, because I think the two texts come through fairly similar in similar timeframes, and it is quite confusing. So maybe we could feed that back up just to make that point, because I do know what Nigel's talking about. So yeah, we can feed that back up through the system, I think. At least we've made that point to them as well. So.
Okay. I've had a very quick look on the chat, and I can see someone said, what's the population of Torbay and what total percentage have had their vaccine? The total population of Torbay is approximately 138,000 people. What total percentage have had their vaccine? I don't know exactly, but I do know that 55% of the 18 to 18 pluses have had it. So over half the adult population of Torbay have had it. Torbay's got quite an aging population as well. Yeah, we've got particular population profile where we've got quite a lot of older and retired people living in Torbay. So that's quite a lot of people. I can give you a more precise answer perhaps as we go forward, but also the vaccination data that we get is a little bit slippery. We tend to get it only at a Devon level, so we'll do what we can, but I think the take-home message is pretty good so far. I hope I've answered that reasonably well. If you want, I'm happy to kind of take that question and try and answer it a little bit better next time. Any other questions? All right, you guys are absolutely the best asset. I mean, we can put out as many social media posts or as many guidances or as many posters and leaflets as we like, but at the end of the day, your people listen to you, not always us. And we can say it till, you know, as my mum would say, till we're blue in the face, but unless someone believes us, it doesn't matter. They believe you, and we promise to tell you the truth always. So yeah, I think you guys are the business. I can see we've got a couple of hands raised. Tracy, would you like to start us off, please?
Hi, yeah. I put a newsletter out just through the school and the church, just sort of saying the sort of things we do, and about if there's any questions we can put them forward. And just, I mean, I've only been joined a few weeks, but I've read all the forums and been through all the forums and just giving what I think is relevant to our school and church population. So I've started doing sort of like a fortnightly newsletter on it. I'm just trying to get the message across. So
awesome. Thank you, Tracy. We're very grateful to have you here.
No problem.
Thank you. Eileen, hiya, how are you? What's your question, please? Can't hear you yet, mate. Take yourself off mute. I'm sure Eileen will join us in a minute. I can see her trying to ask. Oh, there she is. Start again.
I was wanting a bit to see if you've had any feedback from the previous meeting. The person that came to speak to us about the schools, and I wondered about if you've had any more feedback about how the testing's going with the children, and you know what are the recent statistics there.
I haven't, no. I mean, again, we think take-up has been excellent from what we can tell. It's a minority of well, yeah, we just think that it is going pretty well. I can find out though if you want, Eileen, and pop something in the bulletin next week.
Interesting, because she did tell us that, I think she said there was 15 came back positive when she was speaking to us for the previous week. Was it 4?
Yeah. Yeah, really low, wasn't it?
Yeah. I was just a bit curious whether it had gone down or gone up, or okay. Because I speak to like my teenage grandchildren that go to colleges and things, and I get them to tell people how positive the testing's been, and what a good job they're all doing, really, because it's hard for the teenagers and the young children to get a grip of it all. Yeah. So, okay then, thank you.
No, question. I heard someone chatting the other day. I was sort of had myself a little walk off to work, and I heard some people talking, and this woman was saying, "Oh well, I'm not so worried anymore. My boy's at school. He gets tested twice a week." So I thought, if I've got it, he's got it. And I thought, oh man, I'm not going to get involved. I'm here to like take my fresh air, not do public health education. But I can really see where parents are coming from, which is if someone in my house is getting a test twice a week, that's keeping us safe. it's not 100% true, but I can understand the proxy and the kind of idea of it. So yeah, I think it's being well received, generally speaking, the young people getting tests. Right, another question. Kirsty, hi, welcome. What's your question, please, Kirsty?
Not really a question, just you're saying about the parents. Obviously, this is on about parents doing the LFT tests. I don't think there's enough out there for the parents.
Okay, what would you like to see?
I know it's not compulsory, but I mean, I don't live exactly in the area, but I speak to a lot of parents and they say, oh, it's no point, the kids are having the tests done, so what's the point of the parents doing them as well? So maybe it needs to be put out there that parents are able to get LFT tests, and it's recommended that they do 2 tests a week as well as the children.
Okay, nice comment. Thank you,
I reckon
Kirsty.
there's a lot of people that don't realise that.
No, I don't suppose there are. Okay, thank you. Good shout. Julia, you've got a question. What's your question, please, Julia?
It was just a comment to that the previous point there. I'm from a preschool, so we are now all doing our testing the staff twice a week. But we've also had a really nice leaflet that we've been issued by our early years that we've given out to all our, obviously our children are nursery age, so they're not required to test. But we've had a nice leaflet to give out to all the parents, which we've done with a little slip to go with it, you know, inviting them that if they want to get themselves tested, the tests from one of the sort of the sites. And so, you know, parents have been quite interested in that. And we only gave the leaflets out last week, which was when we had them, but we've already had 1 or 2 parents tests from to start testing themselves. So that's, you know, it was a really nice clear leaflet actually.
I think it's a really nice example of how we can influence our people, and it depends on who we are. So I love that you are supporting the parents of the children who are attending your early years setting. I think that shows really good community leadership, really good, you know who you're talking to and what they want to know. So Kirsty, maybe the answer is, can the school do a better job? I mean, we can do all we can in the council and public health, but actually if the school are your credible source, ask the school. Okay, I've got a couple of bits that I wanted to do. Eileen and Julia, you still got your hands up. Did you have another question, or is it a leftover from earlier? Okay, I think they're left over. Eileen and Helen, are there any questions in the chat we need to have a little look at before we move on, please?
No
Okay.
questions.
Right, well then you'll all be absolutely delighted to know. And Nigel, just so you know, these are the same ones from last time, so don't worry, you don't need to join in on this bit. You've answered your questions. It's quiz time. Now, it's all fair and well you asking us loads of questions. We don't mind that, but I think it's time to just check it back with you. So I'm going to do this. Eileen is going to show us her technical skills and launch the poll. I've got 4 true or false questions, which you can answer yes or no. Question 1. There we go. All 4 questions are up now. So question 1, all school children will be asked to carry out a lateral flow test twice a week. Is that true or is it false? Question 2, existing tests can pick up the new variants of COVID in the UK. Is that true or is it false? Question 3, if you wear a face covering, you won't be considered a close contact, even if you were within 2 meters of someone who tests positive for COVID. So let me say that again. If you wear a face covering, you will not be considered a close contact, even if you were within 2 meters of someone who tests positive for COVID. And the last question, 2 households who are not in a bubble can now meet up together outdoors. Does anyone want me to run through those questions again? I'll give you a moment to answer. I can see some answers coming in already. I've got to find my answers. Where have I put them? Helen, you might need to help me out with this. I've put my answers to my questions in my notebook and I can't find them. I think they're in an email, which I can't see as well. Okay, I feel like it's a bit of an all right on the night moment. Oh, look, the answers are still coming in. People are levelling up. Is everybody who wanted to have a vote had a vote? Okie dokie. Well, I think it's time to close it there then, isn't it? Eileen, can you close the polling?
Okay, I'm closing it now.
Thank you.
And I'm going to share the results.
There we go. Okay, so question 1. All school children will be asked to carry out lateral flow tests at least twice a week. 37% of you said true. 63% of you said false. The answer is false. It's only secondary school children that are having it, not all. Oh, that's a trick question. I can see Eileen's fury. That's okay. So the answer is false. It's just secondary and special school children. Question 2. Existing tests can pick up the new variants of COVID in the UK. Is this true or is this false? 84% of you said that it was true. 16% of you said that this is false. The answer is true. We can pick up the new variants as we're finding out about them. I'm going to ask our pal Julia Chisnell to come and talk to you at some point, if this is of interest, about variants of concern and what it means when we talk about the Brazilian. It's not what you think, or the South African. And we've got all sorts of variants that are coming in. And there's certain ways that we test what's a variant under investigation and what's a variant of concern. This might be something that you want to know more about, and if so, you know, give us a thumbs up or drop us a line. But we'll be doing that. Okay, I can see Tracy's thumb. Thank you for that. Helen, Helen P. Oh, look at this. Are you okay to take a couple of the last 2 questions, please, Helen?
Yeah. Can you just read them out if that's okay?
Sure. So question 3, if you wear a face covering, you won't be considered a close contact, even if you were within 2 meters of someone who tests positive. 5% of us said this was true. 95% said that this was false.
Okay, so it's false. It makes no difference whether you've got a face covering on or not. So you're all correct, so 95%.
We love it. And the last question, if you would please, Helen. 2 households who are not in a bubble can now meet up together outside. 32% said true, 68% said false. Bit more of a split on this one.
Yeah, it's false at the moment. You can't at the moment on that one.
Okay, that's fantastic. Well, look, well done, everyone. It's just for fun. We don't know who voted what. You know what you voted, so what you might need to kind of pick up on or what you might not need to pick up on, we'll leave it there. Great, thank you. Just for fun, of course. Don't forget, it's just for fun. So key messages. Testing staff and students weekly helps to pick up the 1 in 3 people who show no symptoms. The PCR and lateral flow tests work well as part of a combination approach alongside other key behaviours and vaccinations, and we need all parts to keep working together. I don't know if you know, but we've got a new Director of Public Health, a very nice man called Dr. Lincoln Sargent, and he's doing a fortnightly video in the way that Caroline Diamond used to do one, and he's done a really good one recently, so check it out. And he's talking about this combination. There's no one thing that's going to get us out of this. It's lots of things. So the testing is one part, the vaccinations are another part, and masks, hands, face, space. We can't stop any of them either. We need all parts to keep working together. So that's still true. Self-isolation for close contact of people with a positive COVID test is still absolutely essential for breaking the chains of transmission. It's a really obvious thing to say, but people get COVID from other people that have got COVID. If you don't know you've got COVID, you don't know you're passing it on. So that breaking the chain is how we do it. Okie dokie. Please, I know it's really hard. The sun's out. We all want to go for a jolly. Oh, I want to go for a jolly. You want to go for a jolly. Eileen wants to go for a jolly. I can see your hand up. But please, let's keep to the rules. We've still got so much to gain, and let's not sort of lose all the hard work we've put in. Eileen, are you waving at me, or are you just sort of feeling friendly? She's feeling friendly. No, she's got a question.
Can I just say, I was a bit concerned that so many of us got question 4 wrong. I'm desperate to meet up with the people from another bubble, and I'm waiting till next Monday. So it's just concerning that, you know, if we aren't aware of it, how many other people aren't? Sorry, but I just needed to say that. Okay.
That's all right, Eileen. I know. It's quite confusing, isn't it?
Well, we can't know everything. That's the issue. No one can know everything. So at least by doing this, we're all aware of it now, so we can pass the message on. That's the issue. You know, now we know we can do something about it.
Absolutely. Thank you. And that's why we do this. Does anyone want to respond to Eileen at all? Or I know that I do a lot of talking. It's up for us. We can all have a chat if you like. Actually, we can't. It's 1:32, so I need to wrap this up, actually. Sorry, no time for a chat. Right, so those are the key messages. Your mission: share a fact with a friend, share a post with your people, and help us recruit a champ, whoever that might be. Sign up is free. You get the bulletin. You can then rewrite your own newsletter and do whatever you like with it, but help us get the word out. That's your job. And we really need you to help keep sharing the right information. If you're on social media, we'd love you to do a hashtag COVID champions and hashtag Torbay. It helps us know who's doing what. It's not essential though. Hashtags aren't your thing. We're not going to cry about it. But if you're feeling brave, and can you all see Buddy? Would Buddy's mum like to kind of say hello, by the way, because this is one of the most beautiful dogs I've ever seen. I think Joe's about. We're doing a few extra bits to try and help understand what's working for you or not working for you around champs. We've got someone who's going to start ringing those of you who volunteered to do a one-to-one interview. He's going to start ringing you in the next week, just so we can get a better idea about what works and what doesn't work. But if you want to take a little picture of yourself, your family, your dog, what being a champ means to you, we'd love to. We promise we'll put it at least in the bulletin, and if we can, we'll put it into our social media. We can't put it in social media if it's got pictures of you or your children in, unless we've got explicit consent. It's just we have to keep everybody safe. So that's it. I'm going to close there. We're not going to bang on. We're 3 minutes over. I'll stop the sharing because it's a bit much, eh? But just to say, it's so lovely to see you all. Thank you for what's hopefully been quite a useful session. If you've got any questions, we'll be around for another minute or two. And if you've got anything you really want for future sessions, drop us a line. We'll always do the very best we can to try and match you up with some of our best local speakers and respond to those needs. We've got some stuff hopefully coming up around long COVID, living with it, and hopefully we'll have something coming up around how we support businesses to get back to business in Torbay, and getting ready for all our tourists to come and see us and ring our tills again and whatnot. So if you've got things you want us to talk about here, let us know. But in the meantime, be safe, everybody. Please be safe. Take care. Nice to see you. Bye, everyone. Thank you.